Hey, I'm Dr. Hampton Howell, board certified plastic surgeon here at Salem Plastic Surgery, and today I'm talking about a breast reduction with my patient who has a few questions about these, and we'll go through the questions.
So what are the benefits of a breast reduction?
So breast reduction is a real helpful procedure for patients who basically have very heavy breasts. They're typically, by being heavy, they develop some drooping over time. And so they really give patients a lot of times a lot of back pain and neck pain, just where all that stuff is kind of, pulling on things. Imagine trying to just carry an extra heavy backpack that's poorly fitting all the time on your front. It really kind of weighs you down and wears you down. It can, give you problems with fitting of clothing and everything else, but mainly it's the symptomatic changes of all that, heaviness and the back pain and neck pain.
Absolutely. What should I expect as far as incisions go?
So the incisions basically typically go all the way around the nipple, from the nipple down to the fold and underneath the fold there. So it kind of looks a bit like an anchor or an upside down T. The incisions technically are permanent. I tell every patient that, whether it's a breast reduction or tummy tuck or a facial cut from trauma, but they typically heal as a nice fine line scar that blends in really well and is easily camouflaged and covered by even small bathing suit tops, and very much worth it for all the benefits that you get with the breast reduction.
Definitely. Are there any procedures that you typically recommend alongside of a breast reduction?
Really kind of just depends on what a patient is wanting or aiming for. So sometimes people wonder about, well, is a lift a part of a breast reduction, or how does that work? So basically a breast reduction has a lift built into it. So if I'm doing a breast lift on its own, then I'm basically lifting and reshaping with those same incisions that we just talked about, but I'm keeping all of that patient's own breast tissue, so we're maintaining her fullness that she has, but just in a better shape and position. A breast reduction is very similar, same incisions like we just talked about, lifting and reshaping, but in addition to that, I'm also getting rid of some of the extra breast tissue that's contributing to that heaviness, so that now we have a better shape and everything, but also smaller and in the size that the patient wants. So, along those lines, I'm always talking to you about, how large do you want them or how small, and that helps guide us. And certain people, if they're really, really large and they want to be really small, I might not be able to get them quite that small, but at least can try to get them as close as I can. And other people may not want to be nearly as small as somebody else. So we kind of talk through, all that, at the consult.
Definitely. Will it affect my ability to breastfeed in the future?
It can, and that's kind of one of those unknowns as far as if it will or won't. I always say that we're kind of messing with the plumbing, so to speak, so things may not work and get back out to the nipple, but there is no danger in doing it, and most people who've had that done are able to breastfeed, and of course there's people who've never had a breast surgery who aren't able to breastfeed for a variety of reasons. But if it's something where it's really important to you to not take any chances on breastfeeding, then you really probably should just wait until after you're done having kids and trying. But if it's something where the heavy breasts are really bothering you from all those symptoms we talked about, then most patients would say, I'll take my chances because the chances are pretty good that it will work, and go ahead and start getting a lot of that symptomatic relief.
Okay. And what should I expect as far as recovery? Will I need a lot of assistance?
You shouldn't need a whole lot. Obviously, you need somebody to stay with you for at least 24 hours because of having had anesthesia. You should be up and about kind of right off the bat. You should be able to move and, do a lot of range of motion and stuff. Certain things, obviously, like running, impact-related things, heavy lifting of, the chest and arms, or like maybe reaching off the tippy-top shelf, those kind of things you'd avoid for a little while. But most people are really up and about doing a lot of those kind of normal activities, the daily living things you do day in and day out pretty quickly, afterwards. And pain, it depends on the person, but most of the time it's not real bad pain at all. And most of the time it's, I always hesitate to say it, but it usually is a lot less than what a patient's expecting, and should be well controlled, by the pain medications that we give you. And most people don't even need the pain meds for all that long.
That's wonderful.
Yeah. Any other questions on any of that?
No, I appreciate your help.
Okay. Well, I hope those are helpful, and we go through everything real thoroughly at the consult, and go through all the nuances based on one particular patient or another, but hope that's helpful.